Villa, what can you tell us about nursing implications when it comes to Jewish patients?
That's a very good question, Bill. But when it comes to Jewish culture, one of the first things that you want to do is ask them about their preferences of care. Generally, they will tell you about their food, rest, and spiritual habits. When talking about diet, especially kashrut or Jewish dietary guidelines, meat and dairy can't be mixed, and there is also no pork allowed. One main point I would like to mention is that they prefer kosher food, and when in doubt, you can always refer them to the dietitian for special diets involving kosher food. Many hospitals have a protocol set up for these types of meals, but when they don't, the patient's family will usually bring them food. Another important topic is end-of-life care and death. The Jewish culture takes into account that the body after death is considered God's, so they try their best to keep it intact without mutilation. Cremation is not permitted, and the body should be buried as soon as possible after death. This means autopsies are not allowed. With any decision regarding end-of-life care, it's important to have a rabbi present. Likewise, all organs and blood should stay within the body, and healthcare providers need to remember that. Also, when they have passed away, you want to close their eyes and put a cover sheet over them. We also want to educate clients about genetic testing available, since 25% of Jewish patients are serious disease carriers that may affect their offspring. Another point, when speaking to the Jewish patient, you want to be sincere and warm. And they also prefer same-gender care, because modesty is extremely important to them. As far as wearing clothes, in a hospital setting, a gown, they usually will wear two, or they will wear their own clothes to maintain that modesty. When it comes to holidays or the Sabbath day or Shabbat, the Jewish client will refrain from work, and this means they're unable to write, flip switches, push buttons, or even adjust the bed. So be aware and regularly check on them since they cannot push the call light. Ask them if it's too bright in the room or make indirect requests. Also, surgeries and discharges shouldn't be made on those specific days. And the only work that can be done is if they're having a life-threatening situation. And that's allowed because life is sacred to them and they want to save it. When it comes to spiritual needs, the Jewish patient engages in a regular prayer and can wear a kippah, cap, or shawl. And sometimes they pray up to 3 times a day, alone or in a group. And when they do this, try not to disturb them if at all possible.